Hey there! Today I'm diving into a topic that affects many, but is often misunderstood: autoimmune gastritis, or AIG. Let's break it down. So what exactly is autoimmune gastritis? AIG is a chronic inflammatory condition where your immune system mistakenly attacks your stomach lining. This leads to damage of the gastric mucosa and a loss of parietal cells, the cells responsible for producing stomach acid and intrinsic factor, which are crucial for vitamin B12 absorption. Over time, this chronic inflammation can cause some serious issues like vitamin B12 deficiency, which leads to pernicious anemia. You might also experience reduced stomach acid, known as achlorhydria, causing poor digestion and a higher risk of infections. In severe cases, gastric atrophy can increase the risk of stomach cancer. Now let's talk about the causes. AIG is an autoimmune disorder, which means your immune system is mistakenly attacking healthy cells in your stomach. There are a few main causes here. 1. Immune system dysfunction. Your body produces autoantibodies against parietal cells and intrinsic factor, leading to their destruction. 1. Genetics. If you have a family history of AIG, your chances of developing it are higher. 1. Association with other autoimmune diseases. AIG often occurs in people with conditions like Hashimoto's thyroiditis, type 1 diabetes, celiac disease, vitiligo, and Addison's disease. Let's also cover the risk factors. Some factors that might increase your risk of developing AIG include having a family history of autoimmune diseases, being female, being over 40 years old, and having other autoimmune disorders or an H. pylori infection. Vitamin B12 deficiency is also a big red flag here. Is there a way to prevent autoimmune gastritis? Since it's an autoimmune disease, prevention can be tricky, but you can take steps to reduce complications. Regular health checkups, managing existing autoimmune conditions, eating a healthy diet, monitoring your vitamin B12 levels, and limiting the use of NSAIDs are all good practices. So what about treatment and management? There's no cure for AIG, but you can manage the symptoms and prevent complications with a few strategies. First up, vitamin B12 supplementation. Lifelong B12 therapy is essential, especially if you have pernicious anemia. This might mean B12 injections in severe cases or oral supplements in milder ones. Next, acid reduction therapy. This includes proton pump inhibitors or PPIs and H2 blockers to reduce stomach acid and prevent issues like reflux. Treating iron and other nutrient deficiencies is also crucial. You might need iron supplements if you're dealing with iron deficiency anemia, and folate and other vitamins to support your blood health. If you have other autoimmune disorders, managing those can reduce overall inflammation. And if you have an H. pylori infection, antibiotic therapy can help slow the progression of AIG. Long-term, without proper management, AIG can lead to pernicious anemia, gastric atrophy, and even stomach cancer. Regular checkups and early intervention are key to preventing these complications. In conclusion, autoimmune gastritis is a lifelong condition, but can be managed effectively with proper B12 supplementation, acid control, and dietary adjustments. If you're experiencing fatigue, weakness, or digestive issues, seek medical advice early on to prevent complications. Thanks for watching and stay healthy.